Our top story this lunchtime, 11 weeks after the first doses started, South Korea is beginning to give certain people their second dose of AstraZeneca's COVID-19 vaccine. Our Seong-woo starts us off.
Nursing home residents and staff under 65 years old are among the first in line for their second dose of the AstraZeneca vaccine, starting Friday. Those under 30 who received their first dose before the government's age restriction was implemented due to blood clot concerns can decide themselves if they want it or not. Around 926,000 people are eligible for the second dose between now and June. People who don't want the second dose now but choose to get it later will not be stripped of their priority recipient status. However, health authorities are urging active participation, noting that data from abroad shows side effects are less frequent for the second dose. The rollout is expected to kickstart the recent slowdown in South Korea's vaccine campaign, along with the nationwide distribution of millions of AstraZeneca vaccines from Friday to early June.
Our supply is enough to vaccinate 30 million people with their first doses by late June. Now is the time to focus on actually inoculating people with the vaccines we've procured.
So far, only some 825,000 people, or 1.6% of South Korea's population, have been fully vaccinated. And with 7,139 more recipients, the number of people who've received their first dose remains at around 3.7 million, or about 7.2% of the population. Meanwhile, South Korea reported 747 new cases of COVID-19 on Friday, with cluster infections still popping up nationwide. It's the second day in a row for the daily figure to be in the 700 range, pushing the total number of cases over 130,000. All but 18 of Friday's new cases were transmitted locally, with regions outside the capital area accounting for over 40% of the total. 2 more people died, raising the national COVID-19 death toll to 1,893. Seong-woo, Arirang News.